what's going on? We see cancer on the rise. I think last time I heard was 1 in 3 people or something are going to get cancer or something ridiculous. Um, I know we kind of covered the basis
Yeah,
speaking
we
before,
covered a lot of
it's
the
all about
bases
diet. Yeah.
because people are eating more junk than ever before. More fast food, more plastics in the food. They're doing everything. Even though there are some people eating healthier and taking better care of their health, there's still a bigger population that are eating more unhealthfully. And we know that the same factors that prevent cancer enhance lifespan with people who have cancer. So let me explain it this way: is that I'll give a few examples. One lady, her name is Pam, and she came to me with metastatic ovarian cancer with 4 liters of metastatic fluid that collapsed her lung. And she had to have, her lung reinflated by sucking out the cancerous fluid and by putting a chest tube in. And she took chemotherapy. And this was 27 years ago, and she was given 6 months to live. This was in, I think, 1997 or something. But in any case, she's still alive today. She didn't have cancer, never came back again. And the reason why the doctors who treated her with chemo told her she probably wasn't going to live more than 6 to 12 months is because even though chemo can decrease the ovarian cancer spread and kill the cancer cells, it doesn't kill every cell. Some cells escape chemo. And those cells, stray cells, start coming back later, and you can't kill them because they're the ones that escaped chemo the first time. They're more resilient. So what this approach did for her is that it improved her immune function so she wouldn't be damaged from the chemotherapeutic agent, destroying her immunity for future resistance against future cancers. And it also allowed the immune system to seek and destroy and to cause apoptosis or destruction of other abnormal cells that were not hit by the chemo, because there was too much cancer there. And when there's masses, the immune system can't go there and remove a big mass or take a stage 4 cancer and completely cure it. But of course, if you have just residual cells, it was very important to allow her to be alive today. And I have another case, another person who had ovarian cancer, metastatic, who would have been dead, who's now lived more than 20 years with it. And I have a relative of mine and also we're talking about patients who had metastatic breast cancer as well. And certainly if they have premenopausal metastatic cancer, it could be a very aggressive cancer that can kill them. And these aggressive cancers that can kill people have cells that are replicating more rapidly. But those more cells that are replicating more rapidly that can kill you are more susceptible to chemotherapy. The indolent cancers, the slow-growing cancers like garden variety breast cancer or prostate cancer, chemo hardly works. It doesn't work at all. It has almost no effect in extending lifespan because the cancer is so slow-growing that it's not going to be killed by the chemo very effectively. So with these slow-growing cancers, it's better to remove the mass of the tumor surgically and then follow the right diet for escaped cells. And with rapidly growing cancers, it's better to get chemo and then treat any stray cells with a diet the same way. So we do see that people with cancer have an opportunity to have a normal lifespan or not get recurrence of the original cancer like they would have expected had they not eaten this healthfully. And I've seen that, in scores of cases, time and time again, in all the people we've been treating. So I have people that come to my retreat here, and they're not really coming for a cancer cure. They're coming to prevent recurrence of their cancer from ever coming back again, for example. You know what I mean?
Have you seen any cases where patients didn't require surgery or chemo?
Yeah. Oh, yeah. I have a woman, she just passed away, but she was close to 100 years old. She came to me, I think, again, it might be 20, 25 years ago, and she had non-Hodgkin's lymphoma, stage 4, masses all over her body. She just went on a diet. Wow. They all shrunk up and disappeared. And I have 2 of those cases already with the lymphoma cases that just disappeared when she followed the diet and never had a recurrence of it again,
Is there a reason why you didn't do the chemo at the time? Was she against it, or did you feel like it wasn't necessary?
We wanted to see, and I've had other cases where people who had, the tumors and the masses were so, we can feel them. They were external. The lymphoma, we could actually feel it and measure it in her groin and in her neck. So when she was following the diet and they started to shrink, we just said, well, let's keep coming back every month. Let's keep measuring them. As long as they're shrinking, just keep going. There was no point in it because she was getting a response almost right away from changing her diet, And I have a lot of men with prostate cancer. which is easy to follow too. We won't do treatment with them or hormonal treatment or chemotherapy because their PSA is going down. So we can measure their PSA and free PSA, and the PSA velocity was going up. And I said, and even some of these men, I'm saying your PSA velocity is going up. Don't even do a biopsy because we know it's prostate cancer. And even a negative biopsy isn't going to tell us it's not prostate cancer. And we don't want your PSA going up to that degree. Let's see if we can get your PSA to level off and come down, which we do. We see the PSA start to level and come down. So we see it start to coming down. So even so I'm saying, just assume you have cancer and let's get rid of it with the diet. Let's see if the body can attack it and get it back going in the other direction, because it's easy to measure. It's harder to measure women with breast cancer. With prostate cancer, we have a blood test that can measure the direction of growth. With the breast cancer, we don't have such blood markers as easy to monitor people with.